Hello and welcome to Good Life, the health show with me, Pooja. And this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. And today we will be discussing an important topic, which is immunization is for our children and what kind of immunization, that is the vaccination, is important for children, as young children are at increased risk of infectious diseases because their immune system have not yet built up the necessary defenses to fight serious infections and diseases. And in today's episode, we are going to discuss on various aspects of immunization, that is vaccination in your children. And to discuss more on this, we have with us Dr. Sthapana Sarmah. So not to waste any more time, I'll straight away move to her and talk more about the topic which we have taken. So Dr. Sthapana, welcome to Good Life, the health show once again. So today the topic which we have taken, it's for the little kids out there, and the mothers would be, I'm glued to the television and they must be hearing it, because today the topic is vaccination or the immunization for little children. So we'll be starting up with the important topics. So first, how you will be starting the topic?
Hi Pooja, it's good to be back. And yes, as you have taken up a very important topic where parents are usually, not only mothers, parents are very apprehensive about vaccinations, including me as a mother. But when we talk about immunization, it is a very safe and effective way of boosting the child's immune system. It's a safe, effective way, and in this way the child can fight against specific diseases against which the vaccines has been given. So immunization includes vaccination and also immunoglobulins. So basically when we use immunization, it's a bigger term, but more popular is the vaccination word.
Vaccination, yeah. This is the term which is actually very much easy for our viewers to understand, that is the vaccination. And in between, I would like to tell the viewers of Good Life that our phone lines are open and the numbers are flashed on your television screens. So if you have any questions on related to the topic, that is the vaccination for your children, so you can call up, and Dr. Sthapana Sarmah is here and she will give you all your answers to your questions. So coming back to you, doctor, again, so you had mentioned about immunization, there are various types. So can you please mention about some of the important things about immunization for children?
Yeah, so when we talk about vaccinations, we have a definite schedule which has been fixed, universal, which is universal immunization schedule, that's why we call it. And this is a definite one which is fixed according to the age, according to the dose that is needed for the child, or whether it's an infant. Infant is one who is less than 1 year, or if it is more than 1 year. So it is dose adjusted and time adjusted. So accordingly the vaccinations are given out. Suppose we start vaccinations right from birth. From birth we give out specific vaccines, then accordingly after at 6 weeks we give out, then we give out at 10 weeks, then we give out at 14 weeks, then again in 9 months, and finally we give the boosters. Less than 1 year we call it the primary immunizations, and after that we start giving the boosters along with a few other live vaccines. And earlier we had very few vaccines in the immunization schedule, but now more and more vaccines have been added. So as we've asked, at birth we give out BCG vaccine against childhood tuberculosis. We also give out hepatitis B, and we give out polio vaccines, oral polio, which so again it's 6 weeks now. Pentavalent vaccine has been included. Earlier we called it DPT vaccines, but now even in the government sector we have the pentavalent vaccines coming up, which is given again in 3 doses, 3 times, 6, 10, 14. And again then we have at 9 months we have the measles vaccine. The measles vaccine, along with measles vaccine, we give a dose of vitamin A solution, which is given orally.
So these vaccines are very important for children.
Very important.
So if we talk about the importance of this vaccination, so could you please put some light on that?
See, first thing is, this is a very cost-effective way. Cost-effective, not exactly cost-effective, because they do cost a lot to the government, but then this is something which is in our hand. You vaccinate and you protect the child against that particular disease.
And this is something which is very important for the kids to work, because it starts from the very tender when they are born, and from then itself this vaccination process starts.
These are the few specific diseases that we have taken up. Suppose we have taken up against childhood tuberculosis, we have taken up against diphtheria or whooping cough, we have taken up against tetanus or pertussis or whooping cough, then we have taken up against measles. These are the diseases which are in our hand. Vaccinate the child, protect him against these diseases. So it's a very effective way of saving your child. And secondly, we have seen that around the world, there are around 2 to 3 million children who die every year because of these diseases. So, I would say that vaccinate your child proper time, in the proper dose, in the proper place, and then save your child.
And how important is for the parents to understand the importance of vaccination? Because sometimes what happens is, like, if doctor also suggests them and give them advice that you have to go for this vaccination, but some parents, they might also neglect some vaccination. Maybe some are important, but some may be thinking, okay, this is not that much necessary. So in that point in time, how do you like suggest, what kind of suggestions do you give it to the parents?
See, Pooja, firstly, the vaccines that we have from the government sections, one which we followed, universal NIS, the National Immunization Schedule, which is from the government side, they have given them list vaccines that needs to be given to your children. We do not have any added vaccines, or only those which are very important for you.
Which are very important, which is necessary for the children.
Very necessary. So, I would request all parents to at least take these vaccinations seriously and give them at the proper time. It's not very good if you forget the dose, time, and you see, it might be such that you have forgotten to take it. If your child was due to take it this today, suppose, and you have forgotten, then of course take it at the next possible opportunity, but don't miss it.
One should not miss it. This is one clear-cut message given by the doctor. You have to be very clear about the vaccination to be put to your children. So my next question would be to you, doctor, that how will a parent or how will a mother come to know that what kind of vaccination is necessary for the children or for her child?
So, firstly, just after birth, the child, the baby, the infant is given an immunization card. Or if she is going to a private practitioner, even the practitioner will give him, the parents an immunization card with what are the vaccines due, clearly written, when. Suppose at birth, next is at 6 weeks, that is clearly written, and what vaccines are to be given. So, when all these things are mentioned, and the parents have to be a little conscious, keep the card in front, and then keep checking from time to time. And especially, and the next vaccine when it is due, suppose the child has come for the vaccinations today, so next vaccine when it is due, the doctor will surely inform her, and she needs to keep it in mind. But in places where we have ashas or where we have ANMs, they are the people who keeps regularly reminding the parents.
So they have taken up that responsibility.
Very much,
But the parents in that place also, they also are very much responsible when they get the list of vaccination to be put to their children. So at least for their remembrance, they can put a Xerox and keep a copies here and there, and they can put it in front of them, which is the place which they use it very frequently, so that they can remember.
This vaccination card which we have said you, the one I am talking about from the government side, this has got 2 sections. One part which you can tear, one which remains with the ANMs or the sisters, and the other which is with the parents.
So the reminder has been given.
Of course, and the ANMs and the ashas in fact goes house to remind whoever is due. And if you don't have an asha in that place, like usually we do, but if you don't, you are going to a private practitioner, then also you have to keep that, especially primary immunization, you need to keep your vaccination card in your wherever, so that you get the easy remembrance. You need to keep in place such a place, and you have to give them at that appropriate time.
And can a child be vaccinated if the child is sick or is suffering from fever? So that is a very confused question.
That is the commonest query that we always get when it comes to see, when it comes to mild fever, suppose less than 101 degree Fahrenheit, or suppose is having a running nose or cough, these are minor ailments where the child can be vaccinated. But there are some contraindications, like suppose the child is suffering from some immunodeficiency diseases, unfortunately with some leukemias or lymphomas or malignancies, then we usually do not give the vaccination accordingly, but they have got special immunizations.
So at that point in time, these kind of points has to be very much remembered, and you have to have a check with the doctor. And if you have any confusion, then your doctors are there to clear cut.
And they keep a track of all your diseases.
And we have also seen that there are awareness campaigns going on in schools also, so that the children are very much safe and their vaccination processes are being done. And nowadays this measles, rubella is also very much. So what do you have to say on that, doctor?
Yes. See, earlier we had only one dose of one vaccine, one antigen in the vaccine. We had only measles vaccine.
Measles vaccine.
Only measles vaccine, which was given out at 9 months and which was then given out after 6 months. After that means 1.5 years. But now we have seen that if one single dose of measles vaccination is being given, it does not give you 100% protection.
Okay.
So it will give you around 68% protection only with one single dose of vaccinations, that is at 9 months.
Okay.
So they went for the second dose. And now from measles, they have also added another component which is rubella. So we call it MR vaccine.
Okay.
So measles,
MR vaccine.
yes, M for measles and R for rubella, which stands for German measles.
Okay.
Yes, and so since both of them have got grave consequences, it's very important that these vaccinations be given out accordingly. As it is, it's included in the immunization schedule. But as a campaign mode now, all children from 9 months to 15 years are being vaccinated by the MR vaccines.
Okay. MR
and where do we get the school children? They are not going to come to you for vaccinations,
very true,
or they do not have the vaccination schedules. I mean, they have already crossed it. Suppose a child of 10 years, she'll only get TT vaccine at 10 years. Otherwise, she's not coming back for vaccinations. So the best possible way that we thought to tackle was to immunize them at schools. So hence the school campaign was taken where we get all the children.
All the children,
yes,
from
up to
all
15
age
years.
groups you get
yes,
all the children.
Age groups.
Okay, so sometimes there are also difficulties to be faced by doctors or some of the groups whenever you go to these kind of schools. So you have to get a proper information from the parents and also from the recommendations from the parents. Some parents might not like it, or they might say that no, we have our doctors, so we'll be giving our child vaccination from there. So at that point in time, how do you make or how do you convince those parents? Because your duty and your job is that every child and no child should be missed from this vaccination.
Yes, no child should be missed from this vaccination is the perfect word. See, parents have got every right to question the doctor what vaccine I'm being given, why in schools, and especially when it comes to immunization, vaccinations, every parents are apprehensive. They feel like taking their kids, taking the child themselves and giving out in schools when they are not present, and they've got every right to be feel apprehensive. But let me tell you that this campaign has been so well taken up, all the trained ANMs are being sent to the schools. The list of the children according to the age, according to the class has been well formulated, and accordingly the number of vaccines which will be given out. And before that, awareness camps are being held. Our health workers, they go and they talk to the parents, or the teachers, even the teachers are being called for the awareness.
So that they also get an idea, they will also have an idea, and then they can also tell their parents.
Yes, because these teachers, we will not be meeting the parents, it's the teachers who are going to be directly in touch. So firstly, the teachers are being made aware, they are being told about the beneficial effect of these vaccines, how they will be given, and these teachers then makes necessary arrangements. If they feel that the parents should have a talk with the health authorities, in fact we ourselves have gone and spoken to parents, and then they can take up the campaign accordingly, and we have seen that it's very effective.
So it happens like whenever you go to schools, first of all you had a word with the principal and also the teachers, and then the teachers take up the matter to the parents and they put it up there in their diary of the students. And I've seen many of the kids like coming at home and they said that Mama, I have to go for a vaccination at school. They are arranging a campaign. So parents have lots of questions. So might be they also come to school, or maybe there is an awareness camp for parents as well, isn't it?
Yes,
so that they have an idea about what are the things you are going to arrange for them.
It depends on the school, how they have arranged. There are some schools who have arranged awareness camp where the health workers or us, we have gone and we have talked to the parents one-to-one. They have questioned, they have cleared all the doubts like that. Or accordingly, the teachers might have convinced the parents. It depends on how the schools, individual schools have arranged
the things.
Yes.
And can you please share some of the experiences if you have organized some of the camps and you have got a good feedback?
Yes.
And so if anything like that, we also want to know about that.
First thing is, as I've told you, parents have got every right to feel apprehensive about, and there were many resistant schools who did not wanted to take up a risk of vaccinations. They did not know what will be the consequences. So I have in fact, when it comes to my children, I have personally gone to that school, even though I was not looking after that district of Kamrup Metro, but still I have personally gone, and in my children's school, the parents were allowed to accompany their children while vaccinating.
Because some might be scared and they will be more comfortable with their mom or dad.
It has got both the positive and negative points. We have seen schools where parents were not accompanying and the children were very brave.
They
were more comfortable because they wanted to show how brave they were. And this vaccine, that MR vaccine, which is, it's just a subcutaneous vaccine, you know, I mean, it doesn't hurt much. That is the main positive points. So the children, yes, out of fear, some of them cries. And if one starts crying, then everyone will. But if they accompanied with parents, obviously it's welcome. According, as I've told you, it depends on the individual school, how they have arranged this campaign. So there were few schools, I had one private school where all the parents were against these vaccines. So they were not at all willing. And then they called the health workers, and even I went to that school and we talked to the parents. We told them the effectiveness of these vaccines, how it's going to be helping them. And it was so nice of them to accept it, and just one single meeting and the next day they had the vaccination.
That is what, like, if you have a clear-cut knowledge about what is happening, because when you hear from someone else, might be things are not the same thing. But when the concerned person tells you something and makes you understand, then you understand the thing properly, and then you get convinced also.
That's very important because when they talk to us and they know, they are assured now that their children are actually in safe hands. And as of, I also have one instance where there was one child who just after vaccination on the second day, on the first day itself, he had a mild fever. And then from second day, he in fact developed rashes. So immediately the concerned, that's what I wanted to tell you, how concerned the authorities are. Immediately that family was visited by that's from a reputed school in Guwahati. So immediately the concerned to the parents, the authorities from the state, they visited with their own doctors, with the state head. They visited, they checked with the pediatricians whether it was one of the, whether it was due to vaccinations. And it was found that it was not exactly due to vaccinations. The child was already exposed to some kind of infections. Because the rashes or the fever, which might come in a day or two, but rashes, that is in the rarest of rare conditions.
So when you inject or when you immunize any of the children, so do you take a medical report of that, if suppose he or she is suffering from something kind of disease?
Yes.
So you have to take a proper check on that.
Yes,
also,
we do.
Isn't it?
Yes. In fact, before, especially in case of a campaign mode, when we do it in a campaign is in a mass scale in schools, as we have told you. So when we do it in a campaign mode, then it's very important that the parents make us aware. There are parents who have told us that yes, one child who was having a little some immunodeficient diseases, then we did not vaccinate him then. So it's very important that the parents tell us about any diseases or problems that a child suffers from.
And accordingly, one should be very open.
Very open, yes.
So you also mentioned that after vaccination is done, so maybe like the child might get fever. So is it possible for all kind of children, or is it like in one or two the symptoms are being seen or something like that?
It depends on the type of vaccination vaccines. Earlier when DPT was there, now pentavalent have come up. So there might be fever, there might be but mild, slight fever, and that for that precautions are taken. Just a single dose, mild dose of paracetamol does help. As side effects, but these are very small consequences you pay for vaccinations. Otherwise, usually, very rarely there are side effects. We call it adverse events following immunization, AEFI cases. So AEFI cases are those side effects. It can depend from mild to sometimes, unfortunately, sometimes it can lead to problems, but that is very, very rare.
So whenever parents come to you and the children comes to you, we're saying that the children are more confident than their parents.
Yes, they were.
So now, because they want to show that they are
in front
very
of
much
their friends.
In front of their friends, or see, I'm not afraid of any vaccination maybe, but when the vaccination has been put, then at that point in time they cry. So do you arrange some kind of like anything for the kids to be normal, like chocolates or anything kind of like to make them light? Any kind of situation arises sometimes.
This was during the training of the ANMs. Even the ANMs, they, let me tell you, they are the best person to get your child vaccinated.
Okay.
They have got such perfect hands. They have been doing only that, and such perfect hands. They know what should be the route of injections. So yes, it depends on the ANM how she manages her place. For that day, that school and that ANM, she is responsible for how to manage her site, immunization site. So yes, there were schools who had arranged for chocolates. Then there were schools, in fact, when they were given the vaccination card after the campaign, when they had taken up the card, they were so proud of it. It was almost like a certificate for them. And everyone clicking photos with that. So that was a very beautiful moment.
That makes them more like happy, and they also give an advertisement to other also. They give a like recommendation to other people also that I have been vaccinated and this my child has been vaccinated. So you should also go for that. And depends on the parents if they are like okay with it or they want to have a word with the doctor, isn't it? So is there any kind of like vaccination which has been used to cure from one to more than diseases? Is kind of like one disease, one vaccination?
Yes, exactly. We have vaccines against one specific disease.
Okay.
Suppose if, that can come in a combined vaccine, combined vaccines, which we call it.
Okay.
Suppose pentavalent vaccines, which I have told you which we were giving it in at 6 weeks and 10 weeks and 14 weeks. These are combined vaccines where we have 5 antigens against 5 diseases. They are given but one antigen will act against only that particular disease.
Okay.
So this might have pertussis, and this will have tetanus, this will have Haemophilus influenzae, this will have against whooping cough. So these vaccines will, one antigen will fight against one disease.
Okay, okay. So this is the process.
Very disease specific.
Okay, disease specific. Okay,
yes.
it shouldn't be related to something else, but it has to be seen that what kind of disease or something has been
They can come as a single vaccine.
Okay.
Suppose earlier we had measles vaccine, or for J we'll fight against Japanese encephalitis. But if it comes even in a combined vaccine, the combined vaccine with whatever antigen we call it, whatever antigen is there in that vaccine will fight against that disease only.
Okay, okay. So is there any kind of like diet one has to be followed? One has to follow like after putting a vaccination, because the child may be crying or something like that. So you have to make the child okay. So is there any kind of like diet one has to be taken care of, that after the vaccination you shouldn't eat this or that? Something like that.
There are no such instructions given, because that you should take a light meal after vaccinations, or you should take a heavy meal after vaccinations, or you should put the child to accordingly whatever the child feels likes. Firstly, let me tell you, this is a very effective, safe and effective measure of protection. You know, so there's no any such guidelines, but accordingly whatever suits the child at that moment, the parents can take up that.
Whichever the child feel likes to have it, because you shouldn't force that children, because already the children have gone through a vaccination process. That's what. So anything you want to add more, and what would suggestions, like important suggestions you would like to give the parents, because you have got such kind of patients to you and they come up to you, many questions, many psychological study you have to do to them. So what kind of things you want to advise?
So the common, you have asked me this question, like commonest problem is when they have this minor problems like cough or diarrhea or fever. Then even in that, if your fever is obviously less than 101 degree Fahrenheit, do not skip that vaccine for that day if you can. And but then if you have skipped, then at least at the next possible opportunity, you should vaccinate your child. You should not skip any vaccines. That is very effective way.
Okay.
And second thing, keep trusting the government, because a very common question is the cold chain. We call cold chain is the temperature maintenance. The medical term, scientific term is called cold chain. So whether the cold chain has been maintained, many of the parents are apprehensive whether the vaccine has been kept at a proper temperature, whether, let me tell you, the most perfect cold chain is being maintained when it comes to vaccinations. So there's very less chance of the vaccines getting damaged, or in case if there is damage, then of course it's cross-checked and they are sent back to from laboratories to get it checked to in fact reference laboratories.
Proper check has been done, and then only it is being like applied to the children, because it's a matter of children and kids out there.
So we're trying to protect.
You have to be double check on that, isn't it?
Yes.
So Sthapana Sarmah, we had a lot of word on vaccination, but I'm sure the viewers and the parents out there must have lots of confusions and questions. So the phone lines are open, the numbers are flashed on your television screen. So if you have any questions, you can ask us, and Dr. Sthapana Sarmah is here and she will be giving you all the answers. But she has mentioned quite a good points, and the points are very easy to remember. And if you have any confusions, then doctors are there and pediatricians are there, and any kind of doctor you can go and visit and get a confusion clear out from him or her. So doctor, coming back to you again on last note, as we are short of time. So on last note, what would you like to tell the viewers out there?
I would like to tell all my
any
viewers,
important vaccination which is very in nowadays, and some disease is very in, so one has to be taken care of. So what would be that?
I would like to congratulate one cohort of parents who had trusted the government, who had repeatedly vaccinated their child against polio, oral polio. We had seen that repeatedly the child has been given oral polio, and there were some parents who used to question why so long, why so many times, but still they kept on giving the dose. And to them I would really like to congratulate, because of that we have been declared polio free now. We are being able to declare, India has been declared polio free. Fortunately, that's a big achievement, let me tell you. We had eradicated disease like smallpox. It's no more there. So now polio has been declared polio free, and in years to come, of course, polio will also be eradicated. Now, now we have taken measles. We are trying to eliminate measles. So that is also very important now, to keep trusting and vaccinate your child. Give the required dose of vaccine which the child is due. Do not skip vaccines. This is very important.
Thank you so much, doctor, for giving us such valuable inputs. And I'm sure the viewers, you must be listening to doctor, and she had given some of the important points to remember. And doctor, if like some points to be remembered and some important basic points to be remembered is that one should not be fear of giving vaccination to the children, isn't it? If the parents are scared, then how confident the children will be? As you have already mentioned, the children are more confident than their parents, but you have to be more confident as well. So then only your children will be safe from all kind of diseases. And I'm sure the viewers who must be watching our show must be getting all their answers if you have any confusions, and getting all the confusions cleared, because the topic which we took today was immunization in children or vaccination in children. And Dr. Sthapana Sarmah was here and giving us all the answers, at least some basic idea. I'm sure the viewers must be clear right now. On that note, we'll slip into a short break, but do come back soon, because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja. And it's time now to move on to a subject which plays a very crucial role in our lives. And in order for our bodies to function properly, it's very important to have a good nutritious diet and a healthy, important diet in our lifestyle. And to get more on this, we have with us Tina Baby Bora, our nutrition expert. And the topic which we have taken today is dietary management in hypertension. So we'll go straight away to Tina and talk more on the dietary management in hypertension. So Tina, welcome to Good Life, the health show. So the topic today, is dietary management for hypertension. So first of all, we'll start with hypertension. Just a clear-cut idea for the viewers out there. What is hypertension? Just a briefing on that.
In a general term, if we want to explain hypertension, it is just raise in your blood pressure level. The normal range is 120/80, and if it is more than that, then a person can be termed as having hypertension. But hypertension is a symptom, it's not a disease. But underlining to that, if someone ignores that, it means the person may have some other chronic illness on the later part of the life. So once a person get hypertension, due to multiple reasons, it may be, maybe the person may be having the overweight, or maybe having family history, or not having proper lifestyle. Due to that, if someone's BP raise up, then and there the person should take seriously.
This is very commonly seen nowadays in every household, isn't it, Tina?
Yes.
So, if we mention about the types of hypertension, so there are maybe, I think there are types. So, if we could put on light some on that.
There are mainly two types of hypertension. One is your essential hypertension. It is like if someone is having a family history, one may get into that if or not following a proper dietary habits, having too much of like junk foods or having too much of foods, fried foods like that in a long run, and keep putting on weight and not having, you know, a schedule of any sleep time or getting up in the morning, not having exercises. So, due to that reason, a person may get into hypertension, and if the stress level is more, it may be one of the reason. So, in this, if these are the reasons, then we termed as an essential hypertension. And secondary hypertensions are like if someone is having diabetes, so due to that also sometimes the blood pressure level raise up, and if someone is having some kidney problem or some due to some drug induced, you know, having too much of painkillers or having certain kind of drugs. So, due to that also the blood pressure may raise up. So, once if the blood pressure goes up, so you should go to a doctor and take proper medication in that, and once if you are on medication, you should not stop it without consulting your physician. So, sometimes it happens like that in practical life. We have seen many people having hypertensive drug, but suddenly if the blood pressure becomes normal, they stop it. So, in that note, the person may get sometimes cardiac arrest also, the BP may suddenly rise up, and it happens like that.
Maybe for some reason the normal pressure has come down, but one has to be very careful about that, and you shouldn't stop their medicine.
Right, medicines and your how you are following your lifestyle. You know, coming to us, many patients, once they are hypertensive, they will ask us that what to eat and not. We give the proper instruction. Once it is controlled, they go back to their old pattern. It should not be like that. If it happens, then if the blood pressure suddenly rise up, so the person may get into cardiac arrest or some heart problem may happen. So, such kind of patients we see daily on our Excel Care hospital. So, in cardiac unit, we always keep on, you know, checking up the sodium potassium level. So, with that, you know, the sodium, how much is the sodium to be given to a particular patient, it has been defined by a doctor, but if it is the sodium is more in the blood, so generally the low salt diet is been followed, less than 5 gram, less than 5 gram in a whole day, in a whole day, that is the salt that we use while preparing the food or the salted food items, that should be completely avoided. You know, you should avoid the salted biscuit.
It should be avoided completely, or you have to lessen the amount?
No, you have to completely avoid it for a certain period of time.
For a certain period, so that the sodium comes to normal level.
To the normal level. Even if it comes to normal level, but you have to keep, you know, checking your sodium and potassium level, because if there is abnormality in that, so the person may have again, you know, cardiac problem.
So, there are certain cases we have also seen that the sodium level comes down. What happens is that, so because the person is already having hypertension, the problem of BP, high BP, but what happens is he's completely following the dietary chart, he's completely following the strict dietary chart, and he's having less salt. But what happens is that if the sodium comes down, the other kind of problem starts up. So, in that case, in time, what a person can be?
In that case, they can take like lemon water, the fresh lemon water can be added the salt, and they can take in that, and like fresh fruit juice can be added with the salt also, extra salt can be added and can be taken. And the normal, as I told you, that when we put sodium, salt restriction, so that restriction is been that time taken over, and you can prepare the food items by adding the normal salt, but you should not take the raw salt, extra salt like apart from the food, like maybe as I told, a packet of like bhujia or maybe snacky biscuits, those things has to be keep
that
it
harms more.
That harms more. Right. The normal salt that we use while preparing the food items, that can be taken, but you know, extra salt should not be added in the food items, or extra salty food items should not be taken.
Okay. So you have mentioned about the types, you have mentioned about hypertension, which is like high blood pressure for common term which we use.
Yes.
So there are risk factors also. You have already mentioned that one can, if not it controlled and if not dietary management is not properly managed, then they can also have a cardiac arrest, isn't it?
Yes.
So if we talk about a proper dietary management, which is the topic which we have taken today, so what would be that, Tina? Starting up with if a person gets up in the morning, so what is the thing the person should do?
First of all, if someone's is suffering from high BP and on medication, as I told, if the doctor has asked you to take you know, the limited amount of salt, like you know, the salt you can add while preparing the food, but the extra salt part has to be cut down, like maybe snacky biscuits, bakery items, and then like all sorts of like carbonated beverages, soda and all that should be cut down. Then you should limit your alcohol, completely stop smoking, and like simple carbs, no, like maida made food should be avoided. Should be limited. Limited. If a person is obese, then in that aspect you have to avoid completely. And then saturated fat items like maybe margarine, vanaspati, dalda, those things has to be avoided completely. And saturated fat means the fat which is, you know, solid at the room temperature. It may be butter also. But yes, you can take a certain, you know, walnut butter, walnut or this one, no, nuts. From the nuts also nowadays the butter is being prepared. So that butter you can take in little amount, but not the butter which is prepared from the full fat milk.
So that has also been taken care of. And there are certain like oil, if we mention about the oil, so which oil is good for these kind of people?
In this kind of people, I suggest basically the bland oil, you know, in the ratio 3:1. So the 3 part will be the vegetable refined oil, it may be the rice bran, or it may be sunflower oil, and blended with mustard oil. One part will be mustard oil. That is.
Sometimes we see that one person cooks in the refined oil and not use the mustard oil completely. So it's better to blend both.
Blend both.
But
if you blend
proportion
both,
should be more of refined.
Yes. The ratio should be maintained, because then only your good cholesterol, the HDL, the high density lipoprotein, which is known as, and the you know, the bad cholesterol, that are low density lipoprotein, will be in you know, in a control measure. If there is abnormality in your lipid profile, if this is known as dyslipidemia, if your LDL is more, HDL is low, and if your triglyceride is more again, so that also affect in your blood pressure level. So in that note, you know, the fat that you take should be the good fat, not the bad fat. The good fat is termed as I told you, you can take bland oil, you can go with a handful of nuts. Nuts also contain fat, but that fat is a good fat. And you should not cook for prolonged, you know, and if you cook prolonged, the nutrient property of certain food items losses, and also the fat which you are using, so it turns into some saturated fat increases in your food items. So in that aspect, prolonged cooking should be avoided. And reheating of the food, keep on reheating, as we have seen, no, the bakery items. So when we go for some fast food, so they are already prepared, pre-prepared, just they again, you know, reheated and served. If a person is having hypertension or is prone of having hypertension, better to avoid such kind of food, reheated foods.
So is it a heredity problem? We also hear from some of the people that your father is having BP, so the child might also, the son might also have. So is it like related somewhere?
It is related.
Somewhere or the other?
It is related. If someone is not following, as I told, if a father is having, or if anybody in the family members is having direct indirect relation, if someone is having high BP, if the person, the next generation may not have, if the next generation is following a proper diet,
if
the lifestyle is fine, if is having as per the height, the weight is maintained, but if the weight is not maintained and not having proper lifestyle, then may have the risks of having
then
the hypertension.
Then we blame the heredity that yeah, your father was having, so you also got it. But it's very much depends on the lifestyle. What we are leading to, isn't it?
Right.
So we have to follow, because nowadays the lifestyle has totally changed. No one has time, so we stick to the foods which is easily available, which is packet food, which is easily available. And what we do is, like, if we don't get time to cook also, then there are some of the online things available, so we just order and we just have it. So those things has to be avoided for some time, isn't it?
Right, and should be limited. And should be limited.
It should be limited.
It should be limited. And I will mention here the trans fat, you know, everywhere now, you know, trans fat, and some food items also it is mentioned, no, free of trans fat. So, but you have to see if it is, even if it is free of trans fat, you have to see in the backside of the food label whether it is contain partially hydrogenated fat. Partially hydrogenated fat means the vegetable oil, it's a chemical process. If the vegetable oil is hydrogenated and it turns to solid form. So, in that case what happened, the trans fat increases. So, that is much dangerous than having 1 teaspoon of butter.
Okay, isn't it?
Yes.
Okay. So, Tina, if we talk about like physical exercises, that is also very much important in this kind of cases. So, what would you tell about that?
Yeah, if a person is having hypertension or prone of it, or having you know overweight, should go for a physical exercise, or nowadays you know aerobics, Zumba, and then yogas. Yoga also, different forms of yoga have come up. So those can be you know can be included. The time management is also important. How you are managing your time.
But these things are like applicable not only for this young generations, but also some seniors also apply it. But if we make them understand, seniors, they won't go for it. So for them, if we talk about some exercises at home itself, like yoga you have mentioned, so they will be more loving to do that, apart from going to some of hitting to the gym or some kind of aerobics out there. So on that basis,
or free hand exercises can be done at home. And the food dietary habit, you know, you should include in your food more of fresh vegetables and fruits rather than having canned foods and processed food items. And also I would like to mention here, you know, cornflakes is a very common item that has been included in every household, but if someone is having very high BP, it is better to avoid, because cornflakes contain high amount of sodium. So it is better to avoid. You go with like homemade some cereals like flag rice or you know unsalted puff rice, that muri, should be unsalted again. I have seen some people having full one bowl of puff rice, but they do not recognize that it also contains sodium in that, because the salt is added while preparing. So it is better to go for unsalted. And also those our young generation are more prone of having popcorns, ready-made popcorns. That also contain partially hydrogenated fat. So better to go for the fresh one. Fresh popcorn is available in the season, so you can buy it and boil it at home.
And that is prepare. Very easily made up and can be easily available, and it doesn't need much time, isn't it, Tina? So Tina will discuss on that, but we have to slip into a short break. So viewers will have to slip into a short break, but do come back soon, because we have lots more on the other side of the break. Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja, and not to forget, I'm still joined by our nutrition expert, Tina Baby Borwa. So Tina, coming back to you again. Before the break, we were talking about some easy methods to cook something which is easily available, and youngsters can also try that, isn't it? So what were you telling about that?
Instead of, munching too much of those processed food items, it is better to prepare some healthy snacks at home. You can roll out some roti and then you cut into thin pieces and just toss with vegetables, that one will give you atta noodles, can be prepared at home, very easy to prepare, and even if you pack, it can be packed for your office. And you can prepare some healthy snacks you can prepare some healthy, you know, burger, and burgers can be prepared at home. You know, atta bread can be cut into round shape, and or the brown bread that is available at market, that can be cut with a katori in a round shape, and then you prepare at home the tikki that is put inside. The tikki can be prepared with oats powder and chickpeas together, boiled together, and then you oats should be roasted, and chickpea and, you know, green peas should be boiled together, and then you mash it, and you put the roasted oat granules over it, and then you prepare the tikki and just flip into between the two burgers, and they can be smear some green chutney sometime, or sometime you can
according
smear,
to the taste
according to the taste. Sometime you can prepare some tomato chutney at home, or sometime you can go with, like, no, chickpeas can be grinded, and you add little bit of olive oil there, and that can be give you another, you know, bread spread. So that is healthy also.
That is healthy, and the things which you have already mentioned, it is very much easily available at home, and you can buy it from anywhere, and you can easily make it. And maybe the preparations can be done a day before, or maybe morning, and then when they come from their office, some from their work, and then they can easily make it, isn't it? And if we talk about the spices to be used, Tina, so what are the spices, if you will put some light on that, because we already had a word for oil. So spices, what would you tell?
Yes, spices are good for hypertension, because we all know, you know, garlic. Garlic, raw garlic, having 2 or 3 pots of raw garlic with our meal, so it decreases our, you know, BP, and or it controls the BP level. And even the onion is also good, because it is another form of like antioxidant. But it is better to take the whole spices rather than having those mixed masala. You know, nowadays mixed masala is available in the market, but they also contain added salt in that. So better to avoid that, and you go with the whole spices. It is much beneficial in that aspect. And then this one, no, methi seed, which is commonly available. Even I always keep on mentioning the seed part, you know, the sunflower seed, and then chia seed and flax seed. All these are very common term, but how people are using that has to be, you know, noted. And you know, that can be added while preparing some curry and some porridges over there. And you know, people have also a notion, you know, overnight soaking of the methi, you know, that can be taken.
The next day, the glass of water that is very good for their health, isn't it?
Even if you can take in that way also, or you can grind the methi powder and can be added while preparing the chapati and all. So in that way also you can take, or even the methi leaves, you know, that is available in the market, that can be boiled, and then after washing and all, you boil it and then grind it, and then can be incorporated while preparing the chapati. So, or preparing some of the, you know, recipes like dal and all, there also you can add the methi leaves. In that way also you can take, but it is not, you know, some people may not like the bitter taste of the methi while having early morning.
The quantity should be like less, and how the person can like it. You have to be very careful on that as well. So Tina, you were talking about the sodium and potassium that is very commonly seen, which may increase sometimes of a hypertension patient. So if we talk about the increase of sodium and potassium, so on that note, what a person can go for and how to reduce there and put it in a normal way?
If the sodium is more, as I told you, we allow the person to have only 5 grams of salt in a whole day, or maybe less than that. That has been decided by the treating doctor. And if and the extra salted food items, no, the
should be avoided.
And also I'll also like to mention here the salted food items, no, like bhujia or salty biscuits. Even the diabetic patients are more prone on having salty biscuits, you know, because they think that sweet is bad for us, so it is better to go for the salty biscuits. But they do not know that salty biscuit contain the other hidden factor, that is the trans fat. So it may, if you in a long run, if you keep on munching those snacky biscuit and there's toast, you know, another biscuit known as toast, if you keep on taking that, so it may raise up your BP, and also the you may have dyslipidemia. the abnormality in the cholesterol level.
Okay. So what happens in that, the term which you are using?
As I told you, that the LDL, HDL, the bad cholesterol, good cholesterol, there may be abnormality in that. The bad cholesterol may raise up and the good cholesterol may come down.
So what are the signs seen in the patient? How will he react on that if the person is having that? So will be any signs or symptoms?
Yes, if it is keep on going on that, it is an underlining factor, if the person is not checking as I told you, normally the people ignore for the BP patients, they ignore going for medical test and all. They think that they are taking medication, so it is okay for them. But in a longer time, if you do not check your lipid profile and all, then what may happen, you may get cardiac problem. And if the potassium level is more in some person, it is better to avoid the green leafy vegetable oats. Oats is good, but if the potassium is more, so it is better to avoid the oats.
It's better to avoid.
And red atta, the chakki atta.
Okay.
So in that aspect, you can take the corn flour, corn atta.
Okay.
Now I'll not say the corn flour is another term, but the corn atta, the makkai ka atta, no?
That is good.
That is good. Or you can go with the ragi atta. Okay. But not
the normal red atta which is available is not good.
Not good for if the person is having high potassium level, and all sort of green leafy vegetables, even the coriander leaves should be avoided. Green papaya, potato, even if a person is not having diabetic, but potassium level is more, then better to avoid the this one. Potato and green papaya and colocasia, the commonly known as kosu, that should be avoided. And also all sort of like stem, stems like colocasia stems or any kind of creepers and which is available, like pumpkin creepers and all should be avoided. And also the fruits and fruit juices.
That is to be avoided.
That is to be avoided.
Which has to be included?
You can include like other vegetables except the potato, colocasia and green papaya. Other vegetables can be included. But if the potassium level is very high, that time you have to boil the vegetables and you have to drain away the water and then you can cook for it. But it should not be for a longer time. I always keep telling, if a person come to me with high potassium, I say to them after 20 days or within a 1 month, you check again your sodium potassium, because even if the potassium goes down, it will be another problem.
So what to do if the potassium goes down and sodium goes down? So that is also another case of like remedy one has to be taken care of, isn't it?
It is better to go, to keep on checking. You have to check it. Without the parameters, one cannot say.
That's what.
If it goes down, then obviously again you have to include the fruits and fruit juices. The doctor will give you medicine. So it is the thing that if you're having high BP, it is better to go for your regular BP check and sodium potassium level and your cholesterol.
So these important terms has to be very care of. One has one who is having hypertension. And in fact, the family members also must be aware of these terms, because hypertension is nowadays very commonly seen in very households. So you have to be very careful. I'm sure the viewers, you are listening carefully, because hypertension, which is the common term which we say is BP, the high pressure. If someone is suffering from high pressure, you have to be very careful about your sodium, potassium, and you have to always have a regular check of these things, because if you don't have a regular check and the BP goes high, and suppose you are eating something and you are thinking that the BP is normal and you are having a normal kind of diet, so that has to be very much kept in mind. And I'm sure whatever Tina is mentioning right now, you are listening and you are getting all the points clear, and there are so many things, Tina, to discuss, but we are short of time and we have to wrap up this show. But I'm sure the viewers, you must have got some of the idea which just Tina has mentioned about hypertension. So Tina, last on, just a quick viewer suggestion, which I always ask in my show, just a quick suggestion, because we are very short of time.
Yes, normally triglyceride is another, a part of cholesterol. So you have to check that also. If the triglyceride is high, people think that it is better to avoid all sort of like fatty foods. But yes, you have to avoid all sort of like bad fat, the saturated fatty items or the fatty items that contain the trans fat. With that also you have to keep check on your simple carb. You know, if your intake of carbohydrate is more, so that also affect in the triglyceride level. So obese person, in case of obese person, it's better to go for the complex carbohydrate. Even if a person is having normal weight but having triglyceride is more, it is better to go for the complex carb.
All right, Tina. So there are so many things to discuss, but basically one has to be remembered, and one person has to remember that you have to have a proper check on your medical intentions, and you don't have to be yourself doctor, and you have to visit a doctor, because doctors are there and they will be giving you all proper suggestions out there. So thank you, Tina, for coming to our show. It was a privilege to have you in our show, and I'm sure the viewers must have got all their answers, because the topic which we took today was very important. And with this, we have come to the end of the show. We hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Wednesday at 3:30 p.m. live. Well, till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.